Kleinskool is a community already struggling with the basics. Sewage runs through its streets, roads are cracked, and for many households, unemployment and poverty are part of everyday life. Now, residents say getting healthcare is another hurdle. Once a week, the mobile clinic arrives. The nurses at times carry their supplies into the councillor's former now vacant office, turning it into a clinic for the day. But most days, this van is used to see patients. Residents say the mobile service is mainly for babies, child immunizations, and family planning. But for those needing chronic medication or other primary health care, residents say the mobile clinic does not provide what they need. That means traveling outside Kleinskool. At 67, Jester Martin has lived with this reality for years. He is a chronic patient and says he's been getting his medication from Western Clinic for 17 years. He leaves at about 6 in the morning to get there before the queues grow.
Kijk, ek wil graag 'n kliniek hê in Kleinskool, né? So die rede vir dit is ek loop Western toe en terug as dit reën daar en wind daar en loop 'n kliniek toe. So en die kliniek is vol daar so, né? En dan moet ek nou wag, ek gaan 7:30 tot daar, dan kom ek about 3:30 terug huis toe. So dis baie vol daar so. En sometimes soek die mense proof of address daar so. En ek het die proof, ek het 'n proof of address, maar ek bly nie na nie. Nou so ek sê vir hulle, ek loop nou al 17 jaar nou al haar kliniek. So hulle kan nie my wegwys nie.
For Annalene Lewis Julius, the mobile clinic does help with her children's healthcare, but she's diabetic and needs her own medication. She says that means walking about 5 kilometers to Chetty Clinic.
Ons het al jare nie 'n kliniek hier nie. Ek myself is diabetic. 5 uur in die oggend dan moet ek loop na Chetty Clinic om my diabetic pille te kry. En dit is gevaarlik om deur die bosse te gaan kliniek toe. Ek is nou al 4 jaar onder diabetic by Chetty Clinic. As die kinders ook siek is, dan ons ook self deur die bosse gaan om ons kinders by die kliniek te kry. Sometimes verwys hulle ons weg aan die kliniek vol, dan ons maar weer met hy siek kind terugkom. Ja, is toe beter maar as hy nou kom af vir ons kinders om hulle aan die lewe te laat hulle kan sterwe.
For residents, this is why one day of mobile healthcare is not enough. They say they've been waiting much longer for a permanent solution. Judith Jordan says the promise of a clinic goes back years.
It was years back. I'm 42 years. It's years back that they were promised the people of Kleinskool that we're going to have a clinic, and they never did so. They never give us a clinic, yes ma'am. Normally they ask for assistance from each other, or they will rather go to a pharmacy, borrow money and go to the pharmacy and buy medicine for them. You understand? Because we don't have a clinic.
The Department of Health says it is not aware of the permanent clinic promise, but it will investigate. It also acknowledges that chronic medication can be a challenge at mobile clinics.
We're not sure about the permanent clinic that was promised to the Kleinskool residents. We are going to investigate. There might be a challenge with issuing of chronic medication, especially at these mobiles. Most of our mobiles, they're only doing preventative services. We do have Old People's Forum at Chetty Clinic every Fridays, meaning that chronic patients from Kleinskool and surrounding areas collect their chronic medication from the clinic. They are brought to the clinic by our own EMS transport.
The department says there is a way for chronic patients to get their medication, including transport to Chetty Clinic. But the residents we spoke to say they are walking. And in Kleinskool, where money is already tight, access to healthcare is not just about how far away a clinic is. It is about where the people can afford to get there. For Newzroom Afrika on Channel 405, I'm Sipha Kema in Kleinskool, Gqeberha.